Hi, I'm Chief Jeff from firefightercode.com, and here's another scenario question that you're likely to face at your fire service interview. As always, my associate behind the camera will ask the question, and I'll answer it as though I'm you, the candidate.
Suppose you're on the scene of a traffic accident and the patient you begin treating makes an exceedingly racist remark, and it's directed at you. The remark is profane and uncalled for. As you continue treating this patient, she continues to make very offensive racial comments and projects her racial prejudice quite clearly. There are other paramedics on the scene. At what point will you request to be relieved from you having to treat this patient?
In many instances, being injured can and usually is very stressful for a patient. I fully understand and appreciate the fact that there will be times that patients will make statements that, under normal circumstances, would be unacceptable. But this isn't a normal situation for the patient, and the EMTs and paramedics should never be offended by the comments of a patient. I also understand that at times, for any number of reasons, patients can become combative, and again, as professionals, we're not to take any words or actions personally. I can say with confidence that I wouldn't ask to be reassigned or removed from patient treatment unless I felt that the patient's actions were hindering my ability to treat them. By that I mean if a patient informed me they were not going to cooperate with me for any reason but asked to be treated by another EMT or paramedic and indicated they would cooperate with him and not me, or her and not me, I would enable another EMT or paramedic to begin treatment of that patient. I say that because there's simply no room for ego in this profession, and if the patient had a preference over who treated him or her, I'd accommodate it if I could. Now, assuming there were no other EMTs or paramedics to take over treatment, I do my very best to calm and reassure the patient that I want to give them the very best emergency care possible, and I'd continue to encourage them as I provided treatment. I can be a pretty persuasive person when I put my mind to it, and in this case, I'd welcome the opportunity to prove my ability to treat anyone, regardless of their personal feelings toward me. The panel is looking to see if you'll quickly back away from the patient or if you'll do your very best to do your job, and that is to treat the patient with professionalism and dignity. In this particular question, they went so far as to say, at what point you'll request to be relieved. The perfect answer is, I won't, unless I perceive patient care to be hindered. In essence, you've told the panel that it really doesn't matter what someone says. You're going to treat them as you would anyone else. You also informed the panel that you're aware that some patients will cooperate with some EMTs or paramedics and not others. Finally, you've told the panel that you don't have an ego so large that you would allow the situation to become a confrontation that you're going to win at all costs.